Hey guys, and welcome to this video. My name is Dr. Shah, and I'm a recent medical school graduate. My aim is to make some videos to help you guys out throughout your medical school journey. I'm going to explain some concepts. It'll be a fun time. I hope this helps. If you like this video, please do end up liking the video, share it with your friends, and put in the comment section what you'd like to see next. With that, let's get started. So this is a question that you'll likely see while studying for your board exams. It's something that's tested pretty often actually. And usually people will memorize this, but if you think about this logically, you don't have to. And hopefully after this video, you won't have to ever. So the question says that an experiment is conducted to check the speed of action potentials in different areas of cardiac tissue. Choose the correct order that corresponds to the speed of action potential in the cardiac tissue from slowest to fastest. So before we even think about A, B, C, or D, let's break down the concept. When I think about cardiac tissue, I imagine three kinds of tissue. You have your normal muscle, you have your nodes, and you have your specialized tissue. What do I mean by all of this? Well, your muscle are your ventricles and your atria. Your nodes are your SA node and your AV node. And finally, your specialized tissue is your bundle of His, your bundle branches, and your Purkinje fibers. These are the basic categories of cardiac tissue that you need to keep in your mind. Let's go further. Specialized tissue, what does that mean? Well, it is specialized for a particular task. And in this case, these tissues are specialized for impulse transmission. I'm sorry for the bad handwriting. As everyone knows, doctors have terrible handwriting. It's something we can't help. But let's forget about the handwriting and let's move on. It's specialized tissue and it's specialized for impulse transmission. The way I think about this is that it's a highway, and as you know, a highway is an area for cars to travel the fastest than any other road. And similarly, the impulse is traveling the fastest in the specialized tissue than any other conduction pathway. Let's move on. The muscle is your ventricles and your atria, and it is also a specialized tissue, but it is specialized for a different task. It is specialized for contraction, just like any other muscle. How I think about this is that it is just a normal road, maybe even not paved like a proper road. It's a normal road and impulses can travel through it, but they won't travel fast through it. The fast impulses, the fast travel of impulses will only be through specialized roads or highways, and that you will only see in the green aisle of these tissues, which is your His bundle, your bundle branches, and your Purkinje fibers. Their main job is to transmit things. That's why they are the fastest in impulse transmission, whereas the main job for ventricles and atria are to contract. That's why they are relatively slow, because it's not their job to transmit impulses. It's just something extra that they can do. Let's move on. Your nodes, you have two nodes, SA node and AV node. This is where you reach a gray area because you have to think about what nodes you're talking about. Your SA node is your fastest conduction velocity tissue in the heart. This makes sense because it is the pacemaker of the heart. Think of a switch. Think of like a switch. The moment you press the switch, you want the light to go on. And that's exactly how the SA node is. It is so fast that the moment you propagate an impulse through the SA node, you want it to immediately travel and cause that light switch, which in this case is contraction throughout the ventricles. So your SA node is the fastest, I repeat, the fastest impulse conductive pathway in the heart. Your AV node is a different story because your AV node lies at a junctional pathway. What do I mean by this? Imagine your heart and you have your four chambers. This is your left atrium, your right atrium, your left ventricle, and your right ventricle. Your SA node lies somewhere here, close to the superior vena cava, and your AV node lies right here, close to the interatrial septum. Your AV node will then join the bundle of His, it'll join the bundle branches which separate to the left and the right bundle branch, and then it'll form these Purkinje fibers in the end that finally contract the ventricles completely. So coming back to your AV node is at an important junctional pathway. The way you think about that is you have your ECG and you have your P wave, and then you have this little duration of time, then your QRS complex, and then your T wave. P, Q, R, S, T. What is the P wave? It is atrial systole. What does that mean? The atria is contracting. What is the QRS complex? It is ventricular systole. What does that mean? It means the ventricles are contracting. What is this little portion in between? This is your PR interval, and this is where the AV node lies. What is the PR interval? It is the time before the ventricles start contracting, aka it is the time before ventricular systole. Now, if I imagine a cardiac cycle, there's two halves to a cardiac cycle. There's contraction, there's relaxation, or there is systole, and there is relaxation or diastole. In systole, you're pushing blood out of the heart. In relaxation, you're filling the ventricles with blood. So the PR interval is the moment when you are filling the ventricle with blood. It is right before ventricular contraction. It is the time when you fill the ventricles with blood. I hope that makes sense so far. So that's how I want you to think about this. The duration of the PR interval is pretty long, and it is long for a purpose, because the longer the impulse takes to go through the AV node, the longer time you are having to fill these ventricles with blood before they can even contract, which makes sense to us because we want the ventricles to fill with blood completely. Otherwise, you're half-assing the ventricles filling with blood, and then you're not supplying adequate blood to the lungs and to the tissues. No, we don't want that. We want the AV node to have a slow route of transmission of impulses so that the ventricles have maximum time to fill with blood. So, coming back to our little flow chart on the side, your AV node is actually very slow. It is actually the slowest tissue in your cardiac histology, because the slower the AV node is, which in medicine we call AV nodal delay, the more time you have to completely fill the ventricles with blood and get ready for that systole, or that contraction of blood out of the ventricles and into the lungs in the body. So we've broken down the concept. The muscles are slow tracks because they're not specialized for this task. The specialized tissue are fast track because they're highways specifically designed to propagate impulses. And your nodes are somewhere in between. Your SA node is super fast. Your AV node is slow because it allows the ventricles to fill with blood. So let's form the answer by ourselves. It says that we want the answer from slowest to fastest. So let's put a slow here, a fast here, and an arrow. Again, we discussed this. The slowest will be your AV node. The fastest will be your specialized tissue, and in that very order. So your His bundle will be fast, but your bundle branch will be faster. And then your Purkinje fiber will be fastest. Why? Because it is the end portion of this whole impulse route. And it is the portion where individual cardiac myocytes are being supplied by impulses. It has to be the fastest because it's the ending of the route, and you want to maximize the speed so that every single cardiac myocyte in sync achieves an impulse for contraction. So the easiest way to remember it is that you have your His bundle, then your bundle branch, and your Purkinje fiber in order, and that is the exact order of speed that they have as well. So you will have your His, your bundle branches, and your Purkinje fibers right here. Your Purkinje fibers are the fastest tissue, other than your SA node, obviously. In your cardiac cycle, your AV node is the slowest tissue. is the slowest tissue in your cardiac cycle. The reason why we're not putting the SA node right here is because the question doesn't involve the SA node. But you guys know that the SA node is the fastest. All right, fair enough. After the SA node is the Purkinje fibers. Let's continue. What comes in between? The muscles come in between. But which muscle? Will it be the ventricles or will it be the atria? And the way I think about that is, if you imagine the heart, this is the atria and this is the ventricle. The atria are shorter and the ventricle is longer. So the impulse by nature has to traverse a longer pathway in the ventricles than if it were to travel through the atria. So just by nature of remembering that, you know that the impulse will take longer in the ventricle than in the atria because it has to pass through a longer distance. So we can put that on our little chart here. The ventricle will come here, and then right after the ventricle, the atria will come here because the atria is a shorter muscle compared to the ventricle, so the impulse will travel faster in the atria than the ventricles. So this is our answer right here. The AV node is the slowest, then comes the ventricle, then comes the atria, simply because of the size of these muscles. And then comes your specialized conduction pathways, which are the fastest, which are your His bundle, your bundle branches, your Purkinje fibers, and your SA node. And with that, we can conclude the video. Our answer is AV node, ventricles, atria, His bundle, bundle branches, and Purkinje fibers. So it's answer number D. I hope you found this video informative, and I hope this was an interesting way for you to remember this concept without having to memorize any facts. I wish you guys the best, and stay tuned for the next video. Peace.